I'm Dr. Brian here, psychiatrist at Schizophrenia Hospital. I'm here to elaborate about the awareness of mental health services and mental health treatment in Uganda, specifically here in Wakiso. As per WHO, defines mental health as a state of complete well-being in which the individual is able to cope with the stresses of normal life, can work productively and make a contribution to his or her own community. So specifically, that's what mental health is as per WHO. Mental and behavioral disorders have a variety of characteristics. One of them is that mental illnesses produce a distressing behavior that can be distressing to both the individual himself and the community. And these are characterized by alterations in thinking, emotions, what we call feelings, behavior that is actually inappropriate to the individual and the community. Still on top of that, somebody can also hear voices of unseen people. These voices can be discussing on what the individual does, or they can be commanding in a way that they will command the patient to be doing things which are actually out of context. Yeah, we call them hallucinations. There are very common mental disorders in the society, and as I can tell you that nobody is immune to mental illness. No society, nobody is actually immune. Anytime somebody can get mental illnesses. However, the most common mental disorders in the society, one is depression. Yes, this depression can be pathological or functional. So, the other one is anxiety disorders. Somebody will just get anxious, schizophrenia, which you people normally call as madness. You see a person behaving the other way around, like carrying things, moving up and down, speaking uncoordinated words. That is actually what we call schizophrenia. Okay? Other conditions that you have in the society is epilepsy. There are a lot of epilepsies, both in children and adults. Still on top of that, we also have some other drug-addicted related mental disorders. Some people use drugs of abuse like alcohol, marijuana, cocaine, that actually predispose them to a lot of mental illnesses. Yeah, maybe another common form of mental illness that is also upcoming is gambling disorder, whereby the youth have actually engaged in gambling disorders like betting, things, which has actually caused a lot of psychological torture and pain, including even crimes as a result of this gambling disorder. The cause of mental illnesses so far is actually unknown, but there are predisposing factors that can actually lead to mental illnesses. One of them can be use of drugs. People have been using these drugs of substances, for example, cocaine, marijuana, even alcohol itself, that actually alter the brain chemistry. So when the brain chemistry is being altered, somebody can actually get mentally ill. And by the way, this alteration of brain chemicals should actually take place for a very long period of time to say that somebody is mentally ill. Secondly, we have also found that there are some diseases, that have actually come up to cause mental illnesses. For example, HIV. You have seen somebody with HIV actually getting a mental illness. Conditions like cancer of the brain, all those can cause mental illnesses. But also, not living family. These mental illnesses can also run in families. So when there is a positive family history of mental illnesses, then there are higher chances of the siblings also getting mental illnesses. Then there is also what we call the biochemical theory, whereby we have biochemicals in the brain, which we call the dopamine, the serotonin, and acetylcholine. So the imbalance of these chemicals will actually lead to mental illnesses. For example, depression is associated with low levels of serotonin. Somebody will get a mental disorder like that. For schizophrenia, if there are higher levels of dopamine, then somebody can be predisposed to schizophrenia.